Hi everybody, today we're going to do a quick consultation about a patient presenting in pain. I'm going to run you through how I do my consultations and how I take a history of the patient. Hi Binu, thank you for coming to the practice.
Pleasure.
Can you tell me what the problem is today?
I'm experiencing a pain from lower left hand side. It's sensitivity to sugary food and also sometimes to the cold.
Okay.
I have this sensitivity for a couple of days now, and I think it's not getting better, but it's not getting worse as well. So I thought there is a problem, and that's why I'm here.
Okay. Is the pain getting worse gradually, or you said it isn't?
No, I don't think so.
It isn't getting worse. Okay. And did you have to take painkillers for it?
No, I don't take
You don't need
painkillers.
to take painkillers. Okay. Has it stopped your day-to-day life?
No.
You can't sleep at night. It hasn't affected your sleep. Okay. Can I just ask you quickly, when was the last time you visited a dentist?
A year ago.
A year ago. Okay. And are you a regular dental attendee, or do you?
I try my best to go to dentist regularly, but due to some circumstances, I might not able to visit regularly, but at least once a
But
year.
you try. Okay. Quickly, I want to know a little bit about your social history. Do you smoke?
No.
And do you drink alcohol?
Occasionally when I'm out with my friends,
Okay. So would you say how many units a week?
probably one or two.
One or two.
Yeah.
Okay. Do you use dental floss?
Yes, I do, yeah.
And do you do that daily?
Yes, I do every night.
And what type of toothbrush do you use?
Electric.
Electric. Okay. So I want to know a little bit more about your diet. So do you have a sugary diet, would you say? Do you drink a lot of sugary drinks? Do you have chocolates and sweets?
Yeah, I mean mostly my drinks is water anyway. I always drink water in between.
Okay.
But I do sometimes eat chocolate and
Okay.
cakes, but not regularly.
Not
Just
regularly.
occasionally.
Okay. What type of toothpaste do you use?
I use fluoride toothpaste.
Fluoride
that
toothpaste.
that was prescribed by my dentist.
Okay, very good. So what I'm going to do now is I'm going to do an examination of your face, and I'm going to see, if there's anything outside your face. We call it the extraoral examination.
Yeah.
So, and then I'm going to see if there's anything related there. Then I'll do an intraoral examination to check inside your mouth, and then what I'm just going to do is I'm just going to feel a little bit about your muscles to see if there's any glands or any tenderness. Open wide for me and close. Okay, any pain here? No? Okay, and no sore throat or anything like that, and there's no pain here or behind your ear. Okay, the reason I'm checking pain behind the ear is in case you're grinding, because if you grind your teeth, you could get pain behind your ear, and that's related because of your TMJ muscles. You have a TMJ joint here, and all the muscles, the masseter muscles, and all that could cause pain if you do grind your teeth. Now we'll have a look in your mouth. When we have a look in your mouth, we're going to check your gums to see if there's any inflammation. We're going to do a BPE record, which is a basic periodontal examination, to check to see if there's any pocketing or bleeding around your gums, and also we'll check your teeth.
Yeah.
When we check your teeth, we check for any wear facets on your teeth, sign of tooth wear. We check to see if we can physically see any holes in your teeth or any shadowing, and also any gum recession, because if you have gum recession, that could also cause sensitivity, or if you've got worn enamel. One thing I forgot to ask is about your diet. Do you have a particularly erosive diet, like acidic
Yeah, I
drinks?
like sucking lemons.
Okay, so lemon is quite acidic, so that could also lead to sensitivity as well. And also if you're brushing too hard, your gums recede, and that could cause sensitivity on the dentine of your teeth. Okay, so after checking all your teeth, I will check your bite. It's called occlusion, to see how your teeth meet, okay, and to see if there's anything, interferences which could cause you to grind your teeth. Okay, I have to add that I also check the soft tissues in your mouth for any ulcers, any sign of cheek biting, because again, cheek biting could be a sign of bruxism or teeth grinding as well. And also we check the roof of your mouth, and we check to see if there's anything which shouldn't really be there. Okay, and then after all this is done, I've gathered all my information, then I know what type type of relevant radiographs to take. Okay, now for your particular problem, I probably would take what we call bite wings, and that's if you haven't recently had x-rays done. Any x-rays? Have you recently had anything?
1 year ago with my dentist.
Okay, but no CT scans or anything, so you should be okay within your radiation dose. And then after I've done that, it's always good to have 2 different types of special investigations. So I like to do what we call sensibility tests, and I like to use endofrost, which will give a good indication of how, you know, if your tooth is vital or non-vital. And also there's another form which is an electric pulp tester, which we can use as well, and that would also give some indication if you've got a nerve problem, or we can eliminate things. After I've done all my special investigations, I look at your radiographs, I check my sensibility testings, then I will come up with a diagnosis, okay? And the diagnosis could be related to your gums, it could be related to your parafunction, your bruxism, it could be related to any pathology of the teeth or gums or anything like that. I will identify all that, and then then I will come up with prognosis. Prognosis just means that how I feel long term this tooth is going to be okay or not okay, or any other pathology happening in your mouth. Very important at this stage to do a risk assessment, because risk assessment identifies other risks which you could have. So potentially risk assessments are risk assessment for caries, for perio, for oral cancer, and for tooth wear. Okay, and then after that we come up with a treatment plan, and the treatment plan would be in 3 phases, which would be stabilization, which will all be prevention and oral hygiene, and if there's any hole there which I could put a temporary filling, then that would be stabilization. Then after that would be restorative phase, which I will actually probably physically do some treatment for you, and maintenance to make sure that you're on the right track. And then according to the DBOH toolkit, which is Delivering Better Oral Health, we will actually give you oral hygiene instructions, okay? And if you are a smoker, smoking cessation advice, and then according to NICE guidelines, we lay out your recall period, okay? And depending on what risks you have. One other thing in the x-ray or radiograph taking, I would suggest definitely a periapical as well, just in case there's some periapical pathology on your tooth. Now, is there anything you want to ask me? I know I've covered quite a lot, but at this point I'm just going to have a look in your mouth, and then we'll see what the diagnosis
is. Of course, yes.
Okay.
Thank you.
Thank you very much, Binu. Thank you.
Thanks.
Thank you for watching. Follow me on Dental Cosmetics with a double S on Instagram. Thank you.